Hello everyone. So in this video we are going to talk about syncope. Syncope is transient loss of consciousness because of decreased cerebral blood flow. It is associated with transient loss of postural tone too, but it spontaneously recovers to its baseline level within seconds to minute. A syncope is preceded by presyncope that is characterized by feeling of impending fainting, sweating, breathlessness, palpitation, paleness, and finally the patient faints down. The mechanism behind faint syncope is global hypoperfusion of cerebral cortex or focal hypoperfusion of reticular activating system. Finally, before going into causes, let's try to understand conditions which mimic syncope. These are non-syncopal attacks. Here we have loss of consciousness as well as loss of postural tone. These include seizure. Okay. Conditions like hypoglycemia and encephalitis have loss of consciousness. Subarachnoid hemorrhage and transient ischemic attack have loss of consciousness as well as loss of postural tone or body tone. Migraine, here a complex migraine can lead to loss of consciousness. Psychiatric syncope occurs in various conditions, and drug-induced syncope, drug-induced conditions of loss of consciousness occur in case of alcohol abuse or other abusive drugs. Now let's try to understand causes. Going into the interesting causes first, the non-cardiac causes. And the most common one of them is a classical vasovagal syncope. It comes under neurocardiogenic type of syncope. A classical vasovagal syncope, vaso means vessel and vagal means vagus nerve. Let's try to understand the most common type of syncope, the vasovagal syncope. In cases of environmental trigger or emotional trigger like standing for a prolonged duration in heat or a heat stroke, fasting, or just seeing blood and needles can lead to activation of parasympathetic nervous system. This parasympathetic nervous system is nothing but vagus nerve. This leads to vasovagal reaction as vagus innervates the heart. It leads to bradycardia and vasodilation of the peripheral blood vessels, leading to pooling of the blood, decreased blood pressure, decreased blood supply to brain, decreased oxygen supply to brain, and finally leading to cerebral hypoperfusion manifesting as fainting. This was the vasovagal shock, that is the most common vasovagal syncope, which is the most common syncope. A situational syncope occurs in case of emotional triggers. A micturition syncope is common in old men. Now in old men we have a large prostate. While in night they wake up for micturating, they strain a lot. The straining leads to activation of the vagus nerve that leads to syncope. That's why in old men it is advised that while they wake up at night for micturating, they must sit at the side of the bed and wait for a while before going for micturation. Carotid sinus syncope occurs in case of carotid sinus hypersensitivity, while neck bending or sudden neck movements, a neck bend, these can cause syncope. And this condition can be diagnosed by using carotid sinus massage that leads to systolic BP fall by more than 40 to 50 mmHg. An orthostatic syncope occurs because of autonomic failure that is seen in case of multisystem atrophy, a Parkinson's disease, or diabetic neuropathy, which is more common cause. A neurovascular syncope occurs in case of a vascular phenomena leading to a neural problem, that is syncope. This occurs in case of Steele syndrome like coronary Steele syndrome and subclavian Steele syndrome. Finally, going into the investigation in a patient with syncope. Syncope is syncope recovers by itself. In cases we have recurrent syncope, we have to rule out cardiac causes. For that, to rule out VT, SVT, Brugada's bradycardia, these all things and block, we will do an ECG and look for QT interval, QR interval, and whatnot. Echo will rule out structural cardiac diseases like valvular diseases, aortic dissection. Okay. And for looking for neurological cause, we will do CT brain, MRI. EEG may be done for seizure. A lab investigation RBS will rule out will tell about hypoglycemia, pregnancy to look for any postural hypotension or orthostatic hypotension what a female may have. So this was a brief about syncope. Hope you liked it. Thanks for watching.